My name is Jeta Bowman, and this is my patient Alex, and today we will be performing a head-to-toe assessment for Nursing 612 at Maryville University. Before entering the room, I've asked Alex to change into comfortable clothing, empty her bladder, and we've obtained a full set of vital signs, her height, her weight, and we tested her distance vision using the Snelling chart. Her vision was 20/20 with no corrective lenses. Upon entering the room, I observed, did a general inspection on Alex's gait, her demeanor, her posture. Her speech was clear. She's alert and oriented times three, and she's very pleasant today. So we will begin. I will wash my hands, and we will begin your assessment with your head and your face, and I'm looking at the position of your head, which is noted to be midline, and the size, which is normal. The skin characteristics of your face is evenly distributed, no blemishes, no lesions, no facial drooping. Your eyes are positioned symmetrical. So what I will do is just kind of palpate your hair and noting the texture of it. It is evenly distributed. It's soft with no shedding. I'm going to inspect your scalp throughout for any lesions or any open areas, and I'm going to palpate for any nodules, any tenderness, and it does move freely. Do you have any pain with me palpating?
No.
Okay. Now, what I will be doing throughout the assessment, we'll be performing different tests on your cranial nerves to make sure they're working properly. So first, I will ask you to close your eyes just tight. Okay, can you clench your teeth? Okay, wrinkle your forehead. Can you stick out your tongue? Can you smile? Okay, and now can you puff out your cheeks? Okay, and that lets me know that cranial nerve 7 is intact. Okay, next I'm going to just inspect your face, and once again I've looked at the skin. I'm going to palpate your facial bones, your frontal sinuses, your maxillary sinuses. And now I'm going to ask you, I'm going to test your temporomandibular joint. Can you clench your teeth for me? Okay, now just kind of open your, okay. Any pain with that?
No.
Okay, and there was no popping or clicking in the joint. The next test I'm going to do on your face is we're going to touch for sensation, and we'll be testing cranial nerve number 5. Okay, can you feel that?
Yes.
Okay, and that's good. Cranial nerve number 5 is intact. I'm now looking at your eyes, the position. They are both symmetrical. Your eyebrows are full and extend to the outer canthus. Your eyelashes curl up, palpating your eyelids, which there's no drooping, and your lacrimal glands. Any tenderness here?
No.
Okay. Now I will look at your sclera and your conjunctiva in both eyes. Sclera is clear, conjunctiva is pink and moist. Clear here, and your conjunctiva is pink and moist. Okay, and we will do a series of tests on your eyes, checking your pupillary response. And the first test we will do is the cover-uncover test. So I will ask you to just focus on a point on the wall and cover one eye, and I will be looking at your pupil. Okay, uncover. Okay, that's good. Now I will just do a direct check for response here. Okay, and consensual. Direct and consensual. Okay, and the symmetrical movement was noticed. Now I'm going to ask you just to focus on my pen light here, and I'm going to move it through 6 different areas, and keep your head still and let your eyes follow. At any time, let me know if you see double. Okay? Okay, and that was good. The final test on your eyes, we started your testing of your distance vision. Now we're going to do your near vision, and I will just ask me, can you read the name on that?
Yes. Sharpie. Sharpie.
Okay, and that's good. And your optic nerve is intact. Okay, from your eyes, we will now move to your ears, and I'm looking at the position of your ears. They are both symmetrical. I will palpate the auricle of both ears for any nodules or any masses. I will also palpate behind your ears. And I will now inspect the inner canal, which there's no redness noted. I'm looking at your tympanic membrane, which is it's pearly gray, and there's no redness noted, no bulging, minimum cerumen present. I will also look at your other ear. No redness in the ear canal. The tympanic membrane is pearly gray and clear with no bulging, no fluid present, minimum cerumen. Okay, and now we will continue with the hearing, and we will perform several tests on your ears. And the first test we're going to do is called the Weber test. And what I will do is strike my tuning fork and place it on your head, and you tell me if you hear the one or the other ear or both ears. Okay. I will strike it again and place it on your mastoid bone, and you tell me when the vibration ends. And after the vibration ends, I will place it at your ear, and you tell me when you no longer hear the sound. Okay. Tell me when you no longer hear.
It's not.
Okay, and that's good. It took longer, but the point was to verify that air conduction was twice as long as the bone conduction, and that is a normal finding. Okay, I'm going to do one more test, and I will ask you to cover one of your ears, and I will stand behind you and whisper a word, and you tell me what you hear. Okay?
Apples.
Okay. Again, the next to you.
Banana.
Okay, and that's good. So that completes our hearing test, and that lets us know that cranial nerve number 8 is intact. Moving on to the nose, I'm looking at the position of your nose, which is midline, and the skin is evenly distributed. There are no blemishes. I will inspect the internal canals. The turbinates are pink and moist, and the septum is midline. And what I will have you to do is just kind of close one nostril and breathe in, taking, okay, and the other one. Okay, and that's good. Now we will move to your mouth. I'm looking at the position and of your lips. No cracking, they are moist. And I will do a full inspection of your mouth. Starting with the buccal cavity. So I will ask you just to kind of open your mouth, and I'm going to shine the light here. And let me know. I'm looking at the our buccal cavity is pink and moist. Okay, can you raise your tongue up? Okay, it is pink and moist there. I'm looking at your teeth, which are beautiful teeth, and all of them are there. Ivory colored. No cracking noticed. Can you raise your tongue down, stick your tongue out, looking at your tongue. It is pink and moist and striated with no lesions. Can you switch your tongue? Okay, the side of your tongue, I'm checking. This is one way to check for any oral cancer. So now I will ask you to just kind of swallow and open again, and I'm going to inspect the back. Okay, the anterior, posterior pillars are present. Palatine tonsils are there. Soft palate, hard palate are shiny and pink. Can you say ah for me? Okay, and the uvula is there in midline. And I'm going to just test your gag reflex. Okay. Yeah. All right. And it's present. Okay. And that's a good thing there. We were testing there with your mouth and pharynx. We were checking cranial nerves number 9, 10, and 12, and they were all intact. I'm moving now to the neck, and I'm looking at the position of your neck, the characteristics of the skin, which is smooth and symmetrical. Going to palpate your carotid arteries one at a time. They are patient. Okay, and there is no jugular vein distension. Looking at the position of your trachea, which is midline. Can you swallow for me? Okay, and your thyroid. I'm checking your thyroid, and it is. Now what I will do is just kind of help you to take a little deep breath, and I'm going to auscultate your carotid arteries one at a time. And your thyroid. Okay, and that's good. Now what I'll ask you to do, can you shrug your shoulders for me? Okay, and that's good. Can you shrug a little bit? Okay, against resistance, and that's good. Next, I'm going to palpate your nose, and I'm going to start here with your preauricular, your postauricular, your occipital, tonsillar, submandibular, submental, your superficial cervical chain, posterior cervical chain, deep cervical chain, supraclavicular, infraclavicular, and if you can kind of raise your arms up, and I will do your axillary. Okay, and that's great. After now, I've already auscultated your thyroid and all, and we have identified that cranial nerve number 11 is intact. Now I will move to your upper extremity, and I'm inspecting the skin, characteristics of the skin, which is uniform with the rest of your body. I'm looking at the muscularity of your arms, which is good. I'm going to check your radial pulses, and I will do this bilaterally in a normal clinical setting, and your brachial pulses. I'm going to look at the palms of your hands. I'm going to look at your fingers and check for capillary refill, which is less than 2 seconds. And what I want you to do is just kind of put your fingers together. Okay, and we're looking for that little diamond shape there, and there indicates that there is no clubbing. Okay, now can you just kind of spread your arms out for me? Okay, bring them down to the side. Okay, now can you do your neck to your chin? Or your shoulder, I'm sorry, yes. Shoulder to shoulder. Now chin and back. Okay, and now we're going to bring your arms up against the resistance, down. Okay, chin forward, back, neck side to side. Okay, and that's great. Now I'm going to check the reflexes, your brachial and your radial. And okay, okay, that's good. So now, next, that completes our upper extremity test, and I'm going to examine the chest area, and we will start with your posterior chest, which is the back. So I will ask you just to kind of turn, can you just flip your legs around on the table, where we can basically see this. And what I'm doing now is, of course, inspecting the skin, and it is uniform. I'm looking at her thoracic configuration, which there's no indication of any barrel chesting. And I'm going to just palpate here for tenderness. Do you feel any tenderness here? Okay. Now I'm going, this is your costovertebral angle, which is your kidney area. Any tenderness here? No. Okay. Now I'm just going to kind of palpate it. Press it here. Any pain? No. Okay. The next test, I'm going to check for the expansion of your lungs. So what I'll do is just have you take some deep breaths out and in, and I'm going to place my thumbs together and My fingers, spread them and take some deep breaths in and out, in and out. Okay. And in doing that, my hands were symmetrical when you breathed in and out. There was even movement. So now what I will do, I'm going to ask you to repeat 99 several times as I palpate down your back, and I'm feeling for the vibrations as you say 99. Okay, start.
99, 99, 99, 99, 99, 99, 99.
Okay, and that's great. The next thing I'm going to do is percuss. And what I will do is just percuss from side to side going down. And I'm listening to the tone as I do this. And I'm listening for any indication of any dullness, which could mean any fluid or solid mass. So I will start here and I'm just going to percuss. Okay. And now, next, I will listen to your lungs. But before I do that, I'm just going to test for your diaphragmatic excursion, and I will be percussing again, once again, and coming down to listen for tones of dullness with your breath held. And normally in a clinical setting, we would do this on both sides, but I'm just going to percuss on one side today. Okay, just kind of take a deep breath in. Mark that spot. Dull there. So what I would normally do is measure the space, and it should be 3 to 5 centimeters bilaterally. So now I will listen to your lung sounds. And I will go all the way down, take a deep breath in, and listening for any crackles or any wheezing, anything that indicates that your lungs are not comparing side to side as I go along, and they're symmetrical. We will do the lateral walls as well. Okay, that sounds good. Okay, and that I'm done or finished with the posterior part, so I'll ask you to flip around and we will do your anterior chest. And once again, I'm noticing the skin, the characteristics of your skin, and I'm just going to place my hand here on your precordium, feeling for any heaves or any thrills, and I don't feel any. And I'm just going to go around to the fifth intercostal space and palpate your apical pulse, which is present. Okay, and I will perform the same techniques. Ask you to say 99 and percuss down as we do that. So 99,
99, 99, 99, 99, 99, 99, 99.
okay, and that's it. That's the vibrations. Now I'm going to just percuss. Sorry. Okay, and that was good. Sounds were even. Now what I will do is listen to your lung sounds as well as your heart sounds. Okay? So as you breathe in and out, I'm going to be listening for lung sounds first. Okay. Okay, and now I'm listening for your heart sounds, and we're going to start with the aortic area. Then we're going to do your pulmonic area, Erb's point, your tricuspid, and your mitral. Okay, and those are all good. Normal S1, S2, no S3 or 4, no. Okay, now I'm going to inspect your abdomen. I'll just kind of slide your shirt up here, and I'm just kind of taking a look at the position, looking for any raised areas, which none are noted. And I'll have you just lie back on the table. Just kind of keep your feet up if you can, and relax those muscles. And I'm just going to kind of shine the light again, inspecting for any raised areas or any bulges, and none are noted. Okay? Going to auscultate or listen to your vowel sounds in all four quadrants. Start with the lower quadrants. And now I'm going to auscultate your arteries. And I'm going to start here with your aortic, your renal arteries, your iliac arteries, and your femoral arteries. Okay? Sounds good. Are you comfortable?
Yes.
Okay. Next, I'm just going to percuss over the four quadrants here. Again, listening for any changes in tone that could indicate anything. And now I'm just going to kind of lightly palpate, and you tell me if there's any tenderness. Okay. And I will palpate a little deeper. Can you tell me? Feeling for those internal organs. Okay?
Mm-hmm.
So what I will have you do, I'm going to have you take a deep breath, and I'm going to actually percuss the margins of your liver. So if you can just listening for dullness. We're going to mark the spot here. Okay, and then change there. And measuring that, it should be 6 to 12 centimeters, which is normal. That's your spleen. Okay, and that's normal. Now, back to the deep palpation. I'm going to have you take a deep breath, and I'm just going to kind of palpate, try to palpate the borders of your liver. Okay? Now, just kind of roll over to the side a little, and feeling for your spleen, which normally it is not palpable. Okay? Have you roll back. Going to palpate for your kidney, which normally cannot. Okay. And now I'm just going to palpate your aorta. Okay. Going to just kind of rub this over and check your reflexes in your muscles in your abdomen. And I'll have you just kind of raise your one leg up at a time. Okay, testing for muscle strength. Okay, down and down, and that's good. So now I'm moving to your lower extremities, and I'm inspecting the skin characteristics, feeling the temperature, which they are warm and dry. I see no lesions. There's no edema noted. I'm going to check for capillary refill in your toes, which is less than 2 seconds. I am feeling for your pulses, and this is your dorsalis pedis laterally, posterior tibial, and can you bend your knees a little bit? And I'm going to assess for your popliteal. Okay, now I'll ask you to sit up, and basically I'm going to check your reflexes, your patellar reflexes. Okay, and then your Achilles. Okay, and that's good. Okay, pull your shirt down. Sorry about that. Now I'll ask you to stand to the floor if you can. And I'm going to ask you to turn, and I'm inspecting your spine. I'm looking at feeling the contour of your spine, any pain or any tenderness?
No.
Okay. What I will do is ask you to bend over for me. And I'm feeling again. Okay. Okay. Stand up straight. What I'm going to ask you to do also, can you raise your leg forward one at a time? Okay. Okay. Against resistance. Okay. Against resistance. Okay. Can you bend from side to side? Okay. Forward and backwards. Okay. And now against resistance. From side to side. Okay. Forward and backwards. Okay. And that lets me know that you have a full range of motion of your spine. Okay? So, Alex, that completes your head to toe assessment, and I thank you for participating, and I thank you for watching.